Basic anatomy, surface anatomy, understanding anatomical landmarks on the surface of the body for clinical identification. Locating internal organs using external landmarks, e.g. the location of the heart by palpation. Used in physical examinations or inserting medical devices such as catheters. Surface anatomy is a branch of anatomy that studies the structures of the human body that are located on the surface of the body. The primary focus of surface anatomy is the study of the contours, shapes, and external features of the body that can be understood by direct observation or through palpation, touch, without the need for aids such as a microscope. In a medical context, understanding surface anatomy is essential for physical examination, surgery, and medical diagnosis. Since many body structures that can be felt or seen on the surface of the body provide clues to underlying health conditions or medical problems. Purpose and importance of surface anatomy. 1. Assisting in physical examination. Understanding surface anatomy allows medical practitioners to examine a patient's body more effectively. By knowing the contours of the body, the location of organs and important structures, the doctor can feel or identify abnormalities, swelling, or muscle tension, for example. 2. Preparing for surgery. In surgery, understanding surface anatomy is very important because many operations are performed by accessing body structures through the outer layer or surface of the body. Understanding surface anatomy allows the surgeon to determine the exact location to make a cut or incision. 3. Localization and identification of internal structures. Many internal body structures, such as blood vessels, muscles, and bones, have positions that can be identified based on surface anatomy. For example, major blood vessels, nerves, or certain muscles can be located based on reference points on the body's surface. Approaches to surface anatomy. Surface anatomy is usually studied by observing reference points and imaginary lines on the body that facilitate the localization of internal structures. Some important techniques and concepts in surface anatomy include 1. Reference points and landmarks. A reference point is an area of the body that is used as a reference to determine the position of an organ or other structure. Examples: the clavicle serves as a reference point to identify the location of chest organs and blood vessels. The sternum, used to map the location of the heart and great vessels. 2. Lines and lines. Transverse lines. Horizontal lines that divide the body into upper and lower halves. Sagittal lines. Vertical lines that divide the body into left and right sides. Frontal or coronal lines. Vertical lines that divide the body into front and back. These lines are used to map the location and orientation of organs in the body. 3. Palpation, touching. Palpation is an examination technique by feeling or touching the surface of the body to identify the structures underneath. This technique can be used to identify enlarged lymph nodes, swelling of internal organs, position of blood vessels and arteries. Examples of surface anatomical structures. Some important body structures can be recognized or felt on the surface of the body through surface anatomy. Here are the main examples. 1. Head and neck, skull bones. We can feel the contour of the skull in the forehead, temples, and back of the head. Neck. Large blood vessels such as the carotid arteries and jugular veins are located in the neck and can be felt. Larynx. The process called Adam's apple or Adam's apple on the neck is the part of the larynx that can be seen or felt. 2. Chest, thorax, sternum. A reference point for finding internal organs such as the heart and lungs. Apex of the heart. The point where the heart beats can be felt around the left intercostal area, just below the nipple. Bottom of the neck, where large blood vessels such as the subclavian artery can be felt. 3. Abdomen. Hip bones. The front of the pelvic bones can be felt on the right and left sides of the body in the lower abdomen. Spine. Can be felt from the spine, vertebrae, and spinous processes which can be used as a reference for various organs in the abdomen. Abdomen. In a physical examination, the abdomen is often checked for swelling, tenderness, or disorders of the internal organs. In the abdomen, organs such as the liver and kidneys can be felt in thin people. 4. Hands and feet. The bones of the fingers and toes. These small bones can be felt, and through palpation, we can identify the position of larger muscles or blood vessels. Blood vessels in the legs. Blood vessels such as the saphenous vein in the legs are often checked by palpation to check for varicose veins or blood circulation problems. 5. Back. Spinous processes of the vertebrae. The protruding ends of the vertebrae can be felt along the back. Back muscles. Some large muscles, such as the trapezius muscle, can be seen or felt through the skin to check for muscle abnormalities. Applications of surface anatomy in clinical practice. 1. Physical examination. A physician can use surface anatomy to identify certain clinical signs that reflect a medical problem, such as swelling, pain, or changes in skin texture. For example, through palpation, a physician can detect swollen lymph nodes or assess the size of organs such as the liver and kidneys. 2. Surgery. In surgery, knowledge of surface anatomy is essential for determining the correct incision point, especially in surgical procedures involving structures beneath the skin, such as the chest, thorax, or abdomen. 3. Medical imaging. For imaging procedures such as X-rays, MRIs, or CT scans, surface anatomy can provide a helpful reference in interpreting the images. taking into account the position and size of organs based on body contours. 4. Medical education. Medical students use surface anatomy as a foundation for learning to recognize body structures in a clinical context. It also prepares them to perform medical procedures that require precision in mapping body structures. Conclusion. Surface anatomy is the discipline that studies body structures that are directly accessible and visible on the surface of the body. It includes identifying body reference points, using palpation techniques to feel internal organs and tissues, and understanding the importance of body lines and patterns for medical diagnosis and clinical applications. A thorough knowledge of surface anatomy is essential to medical practice, whether in physical examination, surgery, or medical imaging.